and we're going to talk just a moment, and then I'll introduce all the panelists and let you have a chance to talk with them and answer any questions. So the format that we have here is that each of us is going to do a section, and then we'll open it up to questions a little bit. And I'd like to tell if you, I'll go to the next slide. And Becky, I don't know that I have control of the slides.
You do. Remember, you use the arrow at the bottom, not your buttons on your.
Okay, arrow at the bottom. Okay, there we go. All right. So we put this workshop together in part because all of us recognize this need of cancer patients and some needs that are just not addressed by the general community. And so I just want to tell you a little bit about Bridget. So I met Bridget last year, and Bridget is a 4-year cancer survivor. And she said, I began my fight with cancer and I had no idea about all the things that would change for me. I didn't understand how the inside of my body was going to make the outside of my body different. I didn't know that my skin was going to be different. I didn't understand that I would get skin discoloration, that my nails would be bad, and that I really just didn't look the way that I used to look. And Bridget's a stylist, and the one thing that she said that really resonated with me is that she said, I always was pretty. And when I had cancer and I was undergoing chemotherapy, I just wasn't pretty anymore. And so when I looked in the mirror, I just didn't see the person that I recognized. And she echoes what a lot of our patients and a lot of our people that we know who have cancer, they feel this way. And unfortunately, there's no one really to talk about it with, because somehow or other people seem to feel a little bit of guilt for worrying about how they look when they are going through chemotherapy and when they're surviving cancer. And really, what I'd like to everybody, if you take nothing else away from this hour, is really that your inner self and your outer self are all intimately connected, and that how you feel, your mind, and how your body goes forward are all connected. And how can we work with both things to help you feel better and to improve what is your quality of life, right? So that's how we started on this particular project of the webinar and workshop. And so what Bridget said, which I thought was really interesting, is she said, and none of the people that she went to was the doctor, I might add. So, and as all of you know, that the doctor visits are really quick. So what seems like a 15, 20 minute, 30-minute visit is all about scans and what to do next and what are the big side effects. And there really isn't place to talk about why my skin's this way, or why my hair fell out, or why don't I have any eyelashes. And so where do you go for all this information? So some people went to the salon. Bridget she said she went everywhere. She went to the salon, the beauty counter, she asked the nail lady, and no one had any particular idea about what to do with these problems. And then came the kicker. Even if they did have a suggestion, they didn't want anything to do with cancer patients, because they think, oh, well, they're very compromised, and so I don't want to get involved in that. So when Bridget and I were talking about the things that we're going to talk about today, she said, oh, you know what? I wish somebody had told me this. And so that's why we are doing this workshop today, for all the people that would like us to say, why didn't you tell me this? And so we're here to tell you. All right. And I've called it oncology self-care, but really it's about paying a little bit of attention to the things that make you feel normal, the things that make you feel that you can be yourself and that you can be your authentic self. You know, for some people, it's looking at their face in the mirror and seeing eyelashes and eyebrows. For some people, it's having their nails done. For some people, it's just the fact that they could spend some time getting a massage or a facial or whatever that things might be that helps you to connect with who you are and take a little rest, improve your sense of well-being, and improve your sense of self. Okay? So I'm going to switch gears entirely, and I'm going to just tell you a little bit about skin. And that way, when Becky and Brooke and Julie talk about all of the wonderful things that they're going to tell you about, you'll have a little bit of background on what exactly is the skin thing that we're discussing. All right, so chemotherapy and skin, I called it a tale of compromise because that's what happens to your skin. Oh, no, that's not. Okay, so when we talk about chemotherapy, the majority of chemotherapy that we have is actually affects rapidly dividing cells. And we talk about this all the time because most of the side effects that we have to deal with are overlap between trying to kill the cancer that's rapidly growing and trying to overlap that with not killing so many of your normal cells that are rapidly dividing. So it's your stomach, it's your intestine, you know, the lining of your intestine, the lining of your mouth, and your skin that are all the rapidly dividing cells. Some examples of the chemotherapy, and I'm sure that all of you know them: Taxol, cisplatin, 5-fluorouracil. Those are all types of chemotherapy. And then a lot of our patients are on anti-estrogen therapy. So Arimidex, Lupron, tamoxifen, those are all examples. And those are medications that stop our natural body hormones, estrogen, testosterone, from working the way that they normally do. And so they affect the skin just as much as the chemotherapy. And I only put this in there just because we talk about the time that you have treatment. Well, the time you have treatment is one period of time, but a lot of people are on anti-estrogens for long periods of time afterwards. And you have to account for how your body's going to change with the different medications that you're taking. So I put this slide up here because so on the left are some of the things that don't really get talked about. And on the right are the stuff that really gets talked about. So when you go to your doctor visit and you meet your nurse navigator and you talk to all the people that give you the medications, they talk about the stuff that's on the right. Almost no one, and you can look at articles, you can look at whatever you like on the internet, almost none of them will talk about these left things. And if you look at the stuff that's on the left, that's the stuff that people see every day. The stuff that's on the right happens when you get your chemotherapy and you're trying to recover from it. But these things on the left are really the types of things that bother patients every single day. And they bother them when you wake up in the morning and you look in the mirror, you brush your teeth, any of these things, you look down at your hands, it's the stuff on the left that you remember. And when I talk with these oncology skincare specialists, of which they are very specialized and very experienced, one of the things they really wanted me to have you remember is that there's a big difference between being on treatment and being after treatment, and the types of things that you can do if you are on treatment versus after treatment. So when you start your treatment, the things that are really important for you are to protect, calm, and hydrate so the skin can heal itself. All right. And when you are after treatment, we can do a little bit more and we can work with whatever's bothering you afterwards. But when we talk about working on those things after, we're talking really about 6 months after treatment has stopped. Okay. Now, my recommendation to you is that you look at the ingredients that are in your products, and Brooke is going to talk about the clean beauty products. Understand that your hair, nails, skin, mouth can be much more sensitive and that your old products may not work for you. And any product that you decide you're going to try, you patch test before you use them. So don't go full on and put it everywhere and find out that you're really sensitive to it. So a little bit of patch test, and the oncology skincare specialists will talk about that a little bit more. And just a small disclaimer is that the products in this presentation are suggestions and they may not work for everyone. And these are our recommendations based on our experience. All right, so let's talk about the skin. The skin is the largest organ of your body. And it's between inside and outside, so that the insides don't come totally outside, and that's why you have the skin. It contains immune cells that protect against infection. It creates a barrier, and if you look from the outside, there's a thing called the stratum corneum, which is really the outside, and the skin's functions are the following. So protection being one, absorption being another, an absorption of vitamins, acids, oxygen, water, all of those things the skin absorbs. It excretes toxins, it excretes water if you're hot, it regulates your temperature. There's secretions, so the sebum that comes from the hair follicles and regulation of temperature. And then in addition to that, what cancer patients note quite a bit is sensation of heat, cold, pain, and pressure are all located in the skin. And you know, for all of you, you notice that you have a lot of skin. So it's a fairly big organ that really is a fabulous and fantastic organ, but we pay very little attention to it as I think more people know about their kidneys and their liver and their stomach more than they know about their skin. So what is the problem with chemotherapy and the effect on the skin? So on the left of this slide is what looks like normal skin. So normal skin has a barrier function, and it's a sebum barrier function. It's a barrier function of the stratum corneum, which is on the left. And so the allergens don't enter, the viruses don't enter, the toxins don't enter, and the epidermal cells are underneath and they bring moisture. And the moisture is regulated in the skin and the cells stay moist. Now, if you have a damaged skin, imagine you have a cut on your skin or a break in your skin because the sebum barrier is not there, then things can go in. So allergens, toxins, virus, bacteria can go in, and moisture, which is really important, can go out. So compromised skin, because we've given it medication and all of these things, no longer has the ability to protect and maintain itself. And if the epidermis is damaged, the skin doesn't hold on to moisture and it's much more vulnerable to environmental toxins. So what is the damage that happens? And so I listed a few of these things because many people don't realize that these are all issues of the barrier function problem. So you can have dry skin, you can have red bumps of flaking, acne, rash, dehydration, and some of these things that are listed on this slide. Excuse me, I too am in a place with a lot of smoke. So let's talk about the moisturizers. So there's different kinds of moisturizers. There's emollient, there's humectant. So the emollient is one that is like lanolin or any of the shea butter. It adds smoothness to dry skin, but can be very greasy. And as you start to add more water to the compound, the less greasy, obviously, that it does get. Then there are products that are anti-irritants. So oatmeal, calendula. And then there's another thing called ceramides. And ceramides are the fats that reinforce the lipid layer and reinforce the barrier. So how do we talk about dry skin? Now, we talk about dry skin in terms, the medical way to talk about dry skin is on the left. The more common way to talk about dry skin is redness, irritation, cracking. And so we talk about mild, and mild is less than 10% of your body. Now, how do you measure this 10% of your body? It's very low tech. Okay, so I don't know if you see my hand, but if you see my hand, the palm of your hand is 1% of your skin. So if the area that you're talking about has more than 1% of your skin, then you're going to have this issue. So how do we talk about the tips? So lukewarm showers, don't scrub your skin. Use a humidifier, loose clothes. Those are all tips that you can do. And the oncology skincare specialist will talk a little bit more about what their best practices are. So then the other thing that happens to people, which they may or may not appreciate so much, and I'm sure that nobody specifically tells you this, is that when you take the chemotherapy drugs, it increases the sensitivity of the skin to UV light, and it leads to faster damage. So if you in the past could go outside and be in the sun for 5 hours and never get a sunburn, that will change substantially when you're on chemotherapy. So the issue is that you must consider going out in the sun. Now, the easiest way not to get a sunburn is not to go out in the sun, but it's actually not a very realistic, don't ever go out. But when you do go out, think about these things. Stay out of the sun between 10 and 2, reapply sunscreen when you can, avoid the tanning booths, and cover up your exposed areas. Now, they seem like really simple things, but you run outside and you don't have a big hat. So you need to really think carefully about this, because patients in treatment will burn very easily. So now we've talked a lot about chemotherapy. Let's talk a little bit about radiation in the skin, because radiation does damage the skin, and it is probably the best way to describe it is like a fairly bad sunburn for lots of people. So how do you manage that? So you wash the area with a non-soap cleanser, you pat it dry, don't rub it because the top layer of the skin will come off. Emollients and moisturizers can be used to decrease the comfort. Sometimes you can use a barrier cream, and of the data that's there, the calendula has the most data for treating radiation damage, but there are other things that work as well, and it depends on people's sensitivities, and each radiation center has their own wish for different kinds of creams that they recommend. Okay, and so this is the last slide that I have regarding this topic, and I've covered a broad range of things, but really to help you to see that the skin has lots of different things that happen to it when you've been under treatment. And so this is actually a picture of one of my patients. And so she had a Taxol-based chemotherapy and then got started on an anti-estrogen. And what you see on her face is, she was not this color when I met her. she had full pigmentation of her face, but then in addition to that, she has all of this hyperpigmentation that is in the form of almost a butterfly rash. So it goes all along her face, up in her hair, and then I can show you a couple of pictures of her nails later, but even her nails got hyperpigmented. She had, every joint had hyperpigmentation on it. And so these are all things that she has to contend with now that she's finished treatment. And so we have lots of different ways of handling all of these things, and this is not how it has to be forever. But again, these sorts of things we deal with later, 6 months, 8 months later, after all treatment or active chemotherapy has finished. And I think what I'd like to leave everybody with is this idea that what you have during chemotherapy isn't always a long-lasting issue, and that there are ways to work on it, there are ways to make you feel better, and there's ways of interacting with your skin after treatment's finished to help you to recover. You may not get back to exactly where you were before, but there's a lot of options if you're willing and open-minded to work on a small and long-term project. Okay. And so my suggestion to all of you that have been through treatment, I applaud all the hard work that you've done. I applaud the journey that you'll take. And with us, oncology self-care is that a little self-love goes a long way. And for the things that you'll learn in this workshop today, I think they'll help you to go forward, and where you feel the sense of inner beauty meets the outer beauty, and you can look in the mirror again and feel good about who you see. All right, and so I'm going to turn my slides off, and I'm happy to answer any questions. I don't really see the chat box, but I guess I can. look a little harder for where the chat box is. And so if people have questions for me,
If you guys have any questions for the doctor, put them in the chat right now while I'm switching out the slides. That would be awesome.
yeah, the chat. Yeah, yeah, that's okay. So if anybody has questions, then Becky, maybe you'll just repeat them and then I'll answer them.
Can you all see Brooke's presentation now?
Mm-hmm.
Okay, great.
Okay, so what other radiation, it says something about what other radiation products. Oh, there, I got it now.
Okay, Brooke,
All right.
I'm gonna give you a remote.
Yes, okay, so I saw the question. So I'll repeat the question. What other radiation products are helpful other than calendula? So the radiation oncologists have a way of grading how bad the radiation damage is. So imagine that you're looking at your normal skin and whatever color, texture, temperature it normally is. Imagine the worst sunburn you ever had with blisters, the skin's peeling off. It looks like the whole top of you has just melted off, okay? That's usually the worst sunburn, all right? And those the physician really has to deal with. If it got to that place, then the physician has to deal with it, and those are prescription products. If you go to the other end and you have a little bit of redness, a little bit of sensitivity, think you just went out in the sun and you just got a little pink and it blanches just a little bit, those are things like calendula. A lot of the radiation facilities will suggest Aquaphor. Now, calendula the formulations of calendula are softer, they're a little bit less sticky, and so a lot of the radiation doctors don't seem to note, and I would say this in the nicest way possible, they don't seem to note that none of us wish to wear sticky, greasy things under your shirt. So they often recommend these things that are like Vaseline, and it comes right through your shirt and it sticks to your shirt, which doesn't seem to help you substantially. So there's a prescription brand called Episerum, which I've recommended to patients, which is also not sticky, and again, a barrier cream. And it really depends on how you feel about some of it and whether you can tolerate some of the barrier creams that are stickier and greasier. And then when you start to get blistering and you start to get any of that, then it's really prescription strength and steroids that will help in those circumstances. But we hope that you never get there, right? That's the hope, is that if we're monitoring it, you shouldn't actually get to needing steroids and having these blistering episodes where the barrier is completely gone.
You have one more question and then we'll move on to Brooke.
Okay, so the petroleum and silicone-based ingredients, I think that's probably a question for Brooke, because she's going to talk all about all these things. And so I'd like to introduce Brooke to you. And I have to say, Brooke is one of my special people, because Brooke, when I was starting out, was one of the first people I met in this journey of looking at skin and who that is. And she was recommended to me by the genetic counseling rep from Myriad. So the genetic counseling rep from Myriad had met Brooke and said, no, you just have to meet Brooke. She's an oncology specialist. She does skincare, and she's located about 10 miles south of me. And so Brooke is an oncology skincare specialist. She is the owner of a spa in Los Gatos. And I'm going to let Brooke explain what is in ingredients, and she can take it from there.
Hi, everybody. Can you hear me?
Yep.
Okay, great. Thank you so much, Dr. Singal, for that really nice introduction. That was, that's very flattering. Yeah, Becky, actually, I took her course a few years ago on oncology aesthetics, and it was really a life-changing course for me. I have been an esthetician since 2015, and also got my Cedesco diploma, which is basically like an international beauty diploma. But I really liked to, I was super interested in cosmetic ingredients from the start because I was actually trained at Aveda, and we talked about plant-based ingredients a lot and the difference between, you know, synthetic and natural ingredients and how they interacted with the skin. And what led me to be even more interested in ingredients is when I had my first job out of school, I was working with product, you know, 8 hours a day, 5 days a week. I was seeing some of the estheticians around me get eczema or psoriasis from touching this product. And I thought, you know, that's going to be me in a few years. Not only that, but my grandfather had leukemia, and I noticed that, or he would ask me what he should put on his skin, and I would make little blends of different oils for him and kind of massage it into his hands, and he had a lot on his head, but anyways, it really made me passionate about wanting to provide that for my own clients. And I think that not a whole lot of estheticians focus on ingredients and really making that like the key point of what, like their mission. My mission is so that, you know, anyone that comes to see me doesn't have to worry about what I'm putting on their skin and how that can affect the health of their body. So that's just kind of the introduction there. Okay, see the arrows now. Okay, so empowering yourself through education. Now, I have to preface this whole presentation with, I did a lot of slides and I kind of got carried away. I'm gonna talk about a lot of stuff, so just, you know, you can comment in the question or the comment box, and I can try to answer anything, but just bear with me. I'm gonna try to keep it simple, but anyways, I just don't want it to be overwhelming. My main points on this slide are that there's so much information out there on the web and just on the internet in general, you know, people claiming that this is bad for you to avoid that, or this ingredient is kind of the cure-all thing. And even cosmetic scientists, I've listened to podcasts by them, you know, YouTube. So bottom line is a lot of people are overwhelmed by the amount of information there is out there. And that was myself included, definitely. Even now studying it, it's something that I continue to study because there's always more information. So be gentle with yourself. You know, just if you can just take away 1 or 2 tips out of this presentation, I would be totally happy with that. Like Dr. Singal was saying, there is a difference between healthy skin versus compromised skin. And the reason why we have to pay attention to, more attention to ingredients when the skin is compromised is that it actually absorbs more of the topical things that you put onto the skin. So it's kind of an easy approach, and maybe some of you have heard this. Pay attention to the first 5 ingredients. Those are the kind of the bulk of what your product is made up of. And also, does the product advertise that it has nanoparticle technology? We don't want nanoparticles. That means it's going to absorb even further into the skin. And usually I've seen this with like sunscreens in particular, which Dr. Singal also went over a little bit. We want to avoid oxybenzone or anything with like zone on the end. So there's lots of little tips here and there that you can kind of just take with you. Fragrance should be avoided, especially if you're going through anti-cancer therapies. In general, fragrance is just, it's really a disruptor. I have this little card here that I got from Becky's training. It has the top 10 ingredients to avoid in your personal care products. And maybe I can send out something to the participants about that. But yeah, fragrance is, it actually can cause a lot of irritation in the skin. Hydroquinone is actually a brightening agent. So in the US, we're very lenient here on ingredients in your cosmetic or personal care products. In the EU and Canada, and I believe some Asian countries, hydroquinone is actually banned. It's one of the ingredients that is has some studies saying that it is a carcinogen. So, and unfortunately, even in a lot of dermatologist offices here, they carry brands that have hydroquinone in it because it is a very effective ingredient in producing results of brightening. Propylene glycol you can find in even like e-cigarettes. It just shouldn't be put onto the skin. Sodium lauryl sulfate is a foaming agent you'll see in a lot of cleansers. And of course, parabens is a preservative helping to prolong the shelf life. You'll see it in a lot of like drugstore brands. So those are kind of the 5 big ingredients I would say to avoid. If you can take notes and write that down, and maybe we can send out some slides or something. But the other tip, pay attention to anything in all caps. DEA, TEA, PEGs, EDTA, PPG. I mean, it can go on, but really you just want to take away that ingredients in all caps are usually not great. They all stand for a longer chemical name. And so it's just basically that chemical name abbreviated, but yeah, it's just a little tip. And then there's businesses now more than ever specializing in like the clean beauty products. So I'm going to go over it later. Not all of these stores, like not all of the products in the stores are necessarily like going to be right for you, but kind of just leaning more towards that way when you do your shopping. I think that would be, that's definitely going to be an asset. I kind of went over some of this already. I can just jump to mineral oil. Mineral oil is actually in a lot of products, but you want to avoid it. It's a conditioning agent, and there's so many other oils that you can use that are going to be therapeutic and beneficial to your skin rather than just kind of putting like this coating over it. Like calendula, like we were talking about, that's a hydrating oil. Tamanu oil is a beautiful oil that you can use to hydrate the skin and also protect it. It's also one of the top 10 ingredients on the card here. Really, these cosmetic ingredients can affect your immune system, your organs, can kind of spark allergies, and also cancer. Now, I don't want to do any fear mongering here. This is all, you know, everything in moderation, and I don't want to, you know, tell anybody, I don't want to scare anybody, but these are just things to keep in mind. In general, when you're going through cancer or even afterwards, I honestly tell all of these tips that I'm talking about in the presentation today to all of my clients. I mean, it doesn't matter if you're healthy or you're going through a medical issue. Why use any of the toxic ingredients? I don't anymore, and but definitely when you have compromised skin, look for products that have that's for sensitive skin, unscented, and oh, what happened here? Okay, unscented, and then adhere to the main, you know, banned of ingredients list, which you can find because it's all over, like anything that's banned in Europe or Canada. You can kind of go by. There's different certifications for different countries, and Cosmos Organic is actually something that is specifically for cosmetic ingredients. We go by the USDA, organic certification for food. This is one that's talking about cosmetic ingredients, and you'll see it on products. I've seen it on some products in the US, but it's definitely more popular for like European or Canadian brands. I was going to say, not all products that are made up of plant-based ingredients are going to be safe for sensitive skin. Like Dr. Single was saying, we want to wait, 6 months to a year after you finish your treatment to kind of be more aggressive with things like brightening and exfoliating. So just the safe way to go is, calming, hydrating, gentle, unscented products. That's going to be your best bet. I wanted to talk about deodorant really quick. So studies have shown that actually 100% of topical ingredients are absorbed in your underarm area and also your groin area. These are places where your lymph nodes are. And so we want to be really careful about what we put or what we use as deodorants. Now, aluminum is not, you want to avoid that. It's known to be an immune organ and endocrine disruptor, which is something like, especially if you have any hormone-related cancers, such as breast cancer, you want to avoid aluminum. Avoid fragrance again, and it's natural to sweat. So just, I wouldn't avoid antiperspirants. You just want to deodorize, right? What I did for this slide, I actually typed into Google clean ingredient deodorant for sensitive skin, unscented, and I found this native deodorant here. It's really easy to find these products if you just do, sensitive skin, unscented, like clean ingredient. I just wanted to touch really quick, and Becky can obviously tell you a little bit more about her products, but highlighting different ingredients in these beautiful products that you received in your box. Your gentle cleanser, hyaluronic acid serum, hydrate, and the skin loving oil. These are all great products to use. Your gentle cleanser has apricot kernel oil, hemp seed, and rosehip seed. These are just ones that I highlighted. Obviously, there's more ingredients in them, but mainly these products are going to protect, moisturize, they're anti-inflammatory, and they're full of vitamins. What we want to do is we want to boost collagen. We want to help with the wound healing and enhancing your skin's barrier. Like we were talking about before, when it is compromised, we want to do everything we can to make it, sorry. Did I just lose everything?
Nope, you're good.
Okay, I don't see the slide anymore.
Did you lose your slides?
I lost it.
Oh no, I hate when that happens.
What do I do?
I'm gonna go ahead and advance just based on time. The next, do you see it now?
Oh, okay, yeah.
Okay.
So yeah, I'm sorry, I'm taking a long time on this. We have your moisture renewal mask and your Elizabeth Essentials Serene, which is essential oils. They're going to be, this one's going to be sprayed in the air. You don't want to apply it directly onto skin. And the moisture renewal mask is going to be great for just hydrating and improving elasticity in the skin. You have your eye cream and your SPF. I use Suntegrity as my SPF every single day. I love it. And it has titanium dioxide, which is very gentle. Places to shop. Definitely look on all of our websites for good products. I have to just give you a disclaimer. Not all of the products on my website are safe for people going through cancer. So I do have a complimentary virtual consultation that you can schedule with me and I'll give you a customized skincare routine if you would like. These are just other places that I found to be helpful to shop at. You can do it online. And they have great sections for sensitive skin. And last but not least, if you want to learn more about the story of cosmetics or more about ingredients, you can just type into YouTube the story of cosmetics. I watched it. It's like 8 minutes long. It has great information. And then also safecosmetics.org is the campaign for safe cosmetics, and it has a lot of information that you can trust about ingredients there. Thank you so much for listening, and I'd like to turn it over to Becky, who is one of the forerunners or front runners of the oncology aesthetics field. She wrote the book on oncology aesthetics, and she's extremely knowledgeable. She's going to bring you through a facial tutorial.
Awesome.
Thank you, Brooke, so much. Before, Becky, we get you started, there's a couple questions that are in there. And so from Mary Beth Gilliam, nice to see you, Mary Beth. She says, sometimes I get a facial rash and sometimes I don't. Is that usual? And I'm confused if it's related to food or to some behavior she's doing. So I'll let Brooke or Becky take that question.
Go ahead, Brooke, while I'm doing this.
Okay, so I can't see any of the questions, actually. I can't even
Do you see the chart?
The what?
Chart, the chat box, the little chat box.
No.
So do you see the remote, the bar at the bottom that has stuff on it, like your remote and all that?
No, it's totally black. The screen.
All right. All right, so let me go ahead and do this. Let's do this. I want a new share here. I don't know why that's not doing that. All right, so what do you think about using frankincense oil as a deodorant? Again, we want to be real careful about essential oils on a cancer patient's skin until you've tested it. And the reason for that is because we don't know how you're going to react to it. And essential oils do go directly into the bloodstream. So I would be real careful about doing that. Frankincense would maybe make you smell good. Okay, so that might be a good reason, but there's lots of good deodorants out there. In your box, you've got the eye cream from Color Up. That line has a great enzymatic deodorant in a couple of different scents that are just wonderful. So again, no fragrance and everything good. But I wouldn't put an essential oil straight on the skin.
I see the chat box now. So Mary Beth says, sometimes I get a facial rash, sometimes I don't. Is that usual? A facial rash, just after a facial, or confused if it's tied to food or another behavior I'm doing. I think, oh, okay. So maybe Dr. Single, you can answer that. She's on Taxol, so.
Well, I think one of the questions to ask is, what products is your facialist or your esthetician using? You know, because they can be irritating or have some essential oils in them as well that you could be reacting to. Even also, if you're in the sun, you could also be reacting with a rash. So it's hard to have a blanket statement, but if you know the products that they're using, we might be able to identify a little bit more why you're having a rash.
Yeah, it can be, it's very individual to everyone. And of course, you know, whether you're going through a medical issue or not, our skin changes over time. You can develop allergies, you can react to different products. So it is kind of a difficult question to answer, but like, I would be happy to, if you wanted to schedule a consultation with me, Mary Beth, and I can answer anything about skincare or ingredients. And yeah.
Right. And then if it's medication related, go back to your doctor and find
Right.
out if that is a common symptom of that particular medication, because a lot of the hormonal ones that the doctor was talking about earlier will cause face rashes in most people.
So I think it's time to go to Becky's, and Becky has something really special planned. And when we were thinking about how to move we had a day of beauty. Brooke and I in February had this day of beauty where the cancer patients came. We treated them extra special, and they had a wonderful time. So we were trying to figure out, how do we communicate a day of beauty to all of you? So that's why we sent you the box. And now it's Becky's turn to show you how to use the things in the box.
We're going to do a little virtual demo here. And
hello, everyone. I am Becky Keene, and I am one of the oncology-trained estheticians that are part of this workshop. And I'm so excited that you're here and going to be joining us today. Hopefully you learn lots of new things and great ways to take care of your skin and to help when you have some of those stress-related or cancer and cancer treatment-related skin conditions. Okay, so we're going to start with, what did you get in your box? Okay, I've got it here. Hopefully I can do this and not spill it. All right, here we go. So I've got all of the products right here. Looks like we're going to have an issue with them disappearing with the background. Okay, so I've got all of my products ready to go. I also have my mask and my little cleansing pads. So before we get started on this, let me tell you a little bit about these products. Why are they in the box? What makes them special? What makes them different? What makes them good? Okay, so in your box, you also got 3 little cards from me, a brochure that has every item in the collection and every ingredient listed. Okay, this is really important. I want you to have all the information. So research that. Then you got a little thank you card from me, a little love note. I am a cancer survivor myself. I've been through what you're going through in my own way. And I remember back when I went through this, how difficult it was to find anybody that understood what was going on with my hair, my skin, and my nails, okay? So that's kind of what led me to putting together this particular set of products. You also got a little prescription card. So this kind of tells you when to use it, how to use it, and why, okay? So, and if you have any questions, you guys can contact me and ask me. I am here for you all through this process, okay? So I've got my little cleansing pads. I've got my warm water, and I've got my headband and everything else. So let's go ahead and get started. Now, if we weren't in the middle of COVID right now, we would be able to invite you in to one of our oncology trained professionals anywhere in the US. I have over almost 6,000 grads now from a course that I teach called Life Changing Aesthetics. And so in the future, reach out to me when we can all go back into spas. If you would like to come and have a special facial, please reach out to me and I will connect you with somebody in your area. Okay, so I'm gonna take my glasses off. I'm gonna put my hair up because I gotta get my hair out of the way. So if you have hair right now, let's go ahead and put it up and get it out of the way so we can do our facial. I'm just gonna use a clip and put that up. And then I'm also gonna put a headband on because I still have a little bit of bang there and I wanna make sure I get everything. So let's get prepared. So we're ready. And now we can start our facial, okay? I've got my space all ready and cleared and ready to go. So I'm gonna start by taking my little pads here and I'm going to wet them. I want my skin wet. So if you're at home and you can do this in front of a sink, much easier, okay? So right now I would be telling you to go ahead and just splash your face with some water. But for me, I'm gonna use the pads with the warm water, okay? So I'm just gonna do a little bit, and I do have makeup on, okay? So we're gonna be taking all of this off. And once I've got my face nice and wet, now I'm gonna take and apply my cleanser. So I've got my gentle creamy cleanser. I would take 1 to 2 pumps. I'm gonna take 2, and I'm going to put it on my fingers like that. And then I'm going to apply it to my skin. And I'm just gonna massage it around. Now this is a nice gentle cleanser with no sulfate, so it's not gonna suds, okay? But then it also doesn't have anything in there that's gonna be harmful to you. And that's the point, right? We want no more toxins. Personal care products, it's super important to watch the ingredient decks and make sure that the products you're using don't have any of the harmful chemicals. Brooke is gonna talk about that today as well, so you'll learn all about that. Once I've done a nice little massage there and massage and lift all of the makeup and dirt off, then I'm gonna go ahead and with my little cleansing pads again, I'm going to remove the cleanser. I don't want any cleanser left on my skin. However, what you're gonna find when you use this cleanser, it is so yummy, guys. It's gonna remove dirt, remove makeup, but it's not going to strip your barrier of really important protecting lipids, okay? So if you're using a cleanser that bubbles, and when you're done, your face feels tight and has no slip to it, you've taken off some of your natural protection, and we don't want that, okay? Again, just making sure I have everything off. Right. Once I have that, now I'm ready to, if you were in to come see us, the next step we would do is we would be taking our skin loving oil, and we would be with this, oh, fingers are wet. Let me get this off here. I'm gonna use the dropper. We never wanna put our fingers in a product, and we never want to touch something that's gonna go back in. So be really aware of cross-contamination, okay? So I'm gonna take a little bit of this, and I'm gonna put it on my fingers, and then I'm going to apply it to my skin. And now we're gonna just do some nice face massage, okay? So I'm doing, as you can see, big circles. I'm stimulating the blood flow. I'm relaxing my jaw. And I'm just doing a nice little massage, okay? We want to just get that in there. If you're like me, I'm very dry. I'm going to be 61 this year. So you know the skin changes as we age. I don't have as much oil and lipids as I used to when I was young, and my skin loves it, sucks it right up. So I'm going to apply just a little bit more. Again, massaging and just allowing that to absorb in. You'll see when you look at the ingredients, there is hemp in here. There is rose hip seed oil. There is jojoba. All of these are what's called mimetic. So it kind of mimics the skin's natural protection, and it gives your skin the protection that it needs so that it can start healing and working on other things inside while you're taking care of the outside. Okay? So again, if we were in a spa, this would be a long, maybe 10, 15-minute massage, okay? So once we've done that, I'm just gonna make sure that I don't have any excess sitting around anywhere. The next thing we're gonna do is apply our mask, okay? So you got this mask, and we're gonna open it up. You can use scissors if you need to. And an important thing about this is we have to make sure that you open it up correctly so that you get everything proper how you need it, okay? So I'm actually going to use scissors.
Sorry, guys. Bad eyes. I couldn't tell if I was still recording.
And I'm going to open it up so that I don't have to use my teeth. Never use your teeth for a tool. I know it's tempting. So once I've opened it up, I'm going to take out this little square of stuff, and you'll see it's got a lot of good moisture on it. Now I'm going to open this up, and you will see that there are 3 pieces to this. So there's a piece on the outside, a piece on the other outside, okay, the 2 outsides. What we want is the mask in the middle, okay? So we take off the first one, like that. And then I'm gonna take off the next one, like this. And what I'm left with is this biocellulose mask that's full of great hydration and ingredients that will nurture and hydrate the skin. So you're going to start by putting it on your forehead, and you can just kind of press it in, and then grab the sides and come around, get every little bit that you can. There's a little nose piece there. So this is what it should look like. It's cooling, it's hydrating. It is so yummy. You guys are gonna love it. Now, what you can do when you're at home, when you put this mask on, is really treat and pamper yourself. Sit down, put your feet up. Read a good book if you want, because you want this on for 20 to 40 minutes, whatever you have time for, okay? And you don't need to do anything. You don't need to be touching it. Just as long as you get it on, you can sit and relax. So watch a movie, read a book, have this be your prayer time, have this be your meditation time, right? And just relax and enjoy. Some people do this before they go to bed at night. So that's another thing that you can do, okay? So after the 20 or 40 minutes, I'm gonna start removing it from the bottom, and I'm just gonna lift it like this. Keep lifting it off, right? And I'm gonna take what is left. Oh, wait till you feel there's some good nutrients in there and ingredients that are calming. There's marine collagen. There's all kinds of yummy things that are just going to be hydrating and protecting and strengthening for the skin. And that mask was made specifically for somebody going through cancer treatment. Okay, so anybody can use it, but made specifically for somebody who's got real dry, sensitive, possibly irritated, maybe some red, flaming skin. Okay, this is going to calm and soothe that. Okay, once we're done with that, we're going to move on to the next product, which is the HA serum. So that stands for hyaluronic acid. Hyaluronic acid is a molecule that has the ability to hold up to 1,000 times its weight in water. Okay, and that's why whenever you put it on your skin needs to be slightly damp. Okay, and I'm just going to rub that all in, all over. Feels so nice. No scent. You'll notice that one of the things that we are really conscious of is no fragrance. Okay. If some of the products have scent, for example, the O Skin Loving Oil, that product has essential oils, and that's where the scent is coming from. So there's no synthetic fragrances or anything that could be harmful or toxic to you. Okay. So just a little bit of smell. This one doesn't have any scent at all. And that's the HA serum. Once I've got that all rubbed in, because I'm a little bit dry, I'm actually going to put another couple of drops of the O Skin Loving Oil on. And I'm just gonna pat that on. Just to give me a little bit of extra skin love, right? And a little bit of extra hydration. Now, the next thing you have in your kit is your Eye Bright by Color Up Eye Cream. And we're going to open up your little tube here. This little jar probably has 3 months worth. That's how little you use. So if you can think of the size of a little BB, that is the size that you want to use. And I'm actually going to use a spatula so I don't stick my finger into it. And then I'm going to put that tiny little drop onto my ring fingers, spread it so it's on both sides, and now I'm going to tap it in all around the eye bone or the ocular bone, okay? We don't go closer than that. So you stay right on the bone. The thing is, guys, these creams move. If you go in too far, it will go into your eye and you'll have some eye irritation, okay? So right along the bone. Yum, it feels so good, okay? Then I'm gonna take my hydrate, and I'm gonna take 2 pumps because that's me. You start with 1 and see if that works for you. Again, I've got it on my hands, and now I'm going to press and tap it in everywhere around. Don't forget your neck. And you know, as we get a little older, everything changes in the sagging department there too. But you know what? Take good care of your skin. And I think age gracefully. You know, I've decided to just take the best care that I can of myself and my skin. And every wrinkle has a purpose and a memory. I smile, I laugh, I've cried in my life, and all of those things to me are badges of honor. So that's how I feel about wrinkles. You might feel differently, okay? Once I have that all rubbed in, the last step that we would do is our, let's see, gotta put it here, SPF, okay? Super important, especially if you are on any anti-cancer drug medications or a medication at all that causes photosensitivity. We need to be sure that we're protecting when we go outside. So now I'm gonna take this. It has a little foil top on it, so just peel that foil top off. And again, just squirt out a little bit. You need enough to where you can actually get the whole face covered. Okay. That's what happens when you have greasy fingers. This is the real deal, guys. Okay. I'm gonna say about that much to start, and then if you are actually going out into the sun today, you are gonna wanna put more, and you're gonna want to reapply in a couple hours, okay? Now, I take and just pat it in, look how you can see it. So this is a zinc-based, it does not have any chemical sunscreen in it. So this is a moisture primer and your SPF. I'm just gonna rub that all in until I've got it all applied. Now, if I wanted to, I could apply my foundation right now. I could also apply a mineral powder, or one of my favorite products from this very same line is their Impeccable Skin, it's called. So it is an SPF and color all in one, so you kind of can skip steps and do it 2 in 1 and get your makeup and your SPF on at the same time. Okay, so that is our facial. How does your skin feel? If you did it with me, I would love to hear how you're liking the products. And if you have any questions, please reach out and let me know. I'm gonna take what's left of my SPF, and I always do this every day too, and put it on the back of my hands, especially if I'm driving, okay? We want to protect everything that we can from that UV. And another thing, this particular product also protects from blue light. And what is blue light? We're learning a lot about blue light damage that happens when we sit in front of a computer or a cell phone, okay? So we want to make sure that we are protecting. Even if you don't go out into the sun, you're still going to want to have some protection, okay? Your skin will thank you. All right, namaste. Have a wonderful rest of the day, and remember that I am here for you. Reach out if you need me.
Yay. All done with that. Does anybody have questions? It looks like we've got some questions in the chat box. I'm gonna see what's going on there real quick. Oh, Full screen. Did everybody get to see the video? I hope so. Not everybody could. Not sure what that's all about. Again, technology, guys. Lou goes, biocellulose, the type of fabric in that Belmondo sheet mask, was originally used in medical applications used to treat wounds. So all kinds of good stuff in there, okay? So hopefully you guys had a little bit of fun watching me, you know, wash my face and take care of it. But if you have any questions, we're here for you. So that's my part. Where do we order the facial products from the demo? So Peg, you can order them. You are a patient of the doctor's. You can order them from her. And also you can order them from me if you ever needed to, but go to Dr. Singal. And
I also sell Suntegrity on my website, as well as the Impeccable Skin that Becky was talking about. It's a beautiful
I'll see you Fred, and we'll figure it out.
moisturizer. Yeah.
yes, perfect. So yep, get in touch with Dr. Singal and then we'll go from there. If she doesn't have it, I know she'll know where to get it. Okay, so let me stop this share and we'll go ahead and move on to the next person, which is Julie. Dr. Singal, you want to say something?
Yes, I was hopefully, okay, I'm not muted. Okay, I was trying to get my screen in order, and I don't know if all of you have tech help, but I have really amazing help. So every time some little hiccup comes, the elves come and they come and help me to reset. So I'd like to introduce you to Julie Bach. I met Julie through another friend of mine, and we connected and started talking about what we would like to do for oncology patients, right? And how we would like to make improvements. And so Julie has a number of things that she works on in the spa and aesthetics world. She works with cancer patients. She works on clinical trials. Really fantastic set of experiences that she's had and willing to share. She's going to talk today about her wellness app, which is specifically for cancer patients. And then she's going to do something really special with us because, you know, it's a tough time for all of us, you know, and you add that to that you have cancer. And we really need just a moment of grace and and she's going to show us a few things that we can do every day to help us through the day. And so I'm going to turn it over to you, Julie, and thank you for all of your great advice in advance.
Thank you. Well, first, Becky, thank you for that beautiful video and tutorial, and I'm really grateful for you, so wanted to just express that to you. Is it possible for me to see everyone? Because I can only see the panelists. It is not. Okay, so we have, I can't hear you. You're on mute, Becky.
Not on a webinar.
Okay, perfect. So I get to see the four of us. I'll talk about the app afterward. Well, I guess I can briefly talk about it. So the idea of the app came about by looking at several studies and understanding that there is no global app or even US app for well-being, yoga, meditation, mindfulness, but also body positivity, hot flashes, beauty, inner and outer beauty. And so what we want to do is we'll be launching the app in December or January, most likely December, and we're looking for a pilot group to test all the different kinds of functionalities that we have, the different courses, the different subjects, so that we understand more how as an industry and also as the medical industry can better understand individuals' needs, but more importantly as well, how people interface with technology. So it's on one hand, if we gave you a survey, people would say, yes, I want all these things, but actions and behavior may be different. So that's what we want to test, is what kinds of subjects, what kinds of words. Some people might want more cultivating joy. Other people might look at it as I'm depressed. So we want to look at which words and what filters, for example, trigger individuals to look for things. Some people want free flowing, some people like structured courses. So this is an opportunity for us to work collectively, and we'll be inviting over 100 wellness and cancer organizations to participate in this first global platform. There's a lot of really good work being done, but they're in small little silos. And so the idea is to let people from all over the world be able to have access to information, not just the information that they may hear about. So we've all been sitting for at least an hour. I'm on the floor. Looks like most people on a chair. So let's just take a moment and go ahead and stand up if you can and just stretch, you know, however stretching looks for you. It could be twisting, it could be anything. Just go ahead bringing your hands up, or if you're on the floor like me, that's fine too, but just making sure that you're stretching a little bit, that you're moving. Perfect. And we'll just do a few movements right now as well. And so just go ahead and take your face and look forward, and sitting in any comfortable position. So if you want to be on the floor, if you want to be in a chair, perfectly fine. If you want to be in your bed, if you are in a bed, that's okay too. You're probably more comfortable. So taking your head and turning to the right gently, and coming center, turning to the left and center. One more. Right, go slow, and center, left, and center. Bringing your chin to your chest, slowly. You might be feeling it from your text neck, bringing center, slowly. You may have to support your neck, depending, and bring your neck back. Let it hang there for a moment. Coming back to neutral, slowly. Do that again. Neck down. Neutral. Neck back. Looking up. And center again. This time we'll just do little neck rolls, okay? A lot of us are on our phones and computers all day. So bringing your chin to your chest and slowly turning to your left ear is over your left shoulder. Coming back down, bringing your right ear over your right shoulder. You might hear a little crunching. And doing that one more time. All the way over, left ear over shoulder. Coming back down, right ear over right shoulder. Coming back to center. Bringing your head back to neutral. Now you can figure out the back part, bringing your neck back. And again, just now bringing your right ear over your right shoulder. Coming back, left ear. So we're doing half circles purposely. And one more time, right over right. Coming back over, left, and center. Okay, let's move our shoulders for a moment. So do some shoulder rolls. So you can either just come back like that. Do 10 coming back. Nice. And then go 10 forward. Ten can feel like a lot. If you can't do 10, that's okay. Okay. Now, bringing your right hand, if you're sitting in a chair, so your right hand will be next to your hip. Bring your left hand on your knee and just gently turn to the side. Come back center. Left hand near your hip. Right hand over your left knee. And just gently turn. Good. Come back to center. Bring both hands on your knees. We're going to do what's called cat and cow. So first, we're going to bring our chest forward. And then we're going to hunch forward a little bit. That's our cat. And bringing our chest forward again. And coming back. And neutral. Perfect. Last is just to bring your arms up. If you can't bring your arms all the way, you might be able to bring them here or down here is fine too. Okay? Perfect. And then just pulse just a little bit. Okay? Okay. And bring your hands to center. So usually when we do yoga or meditation, we typically do what's called asana. We move before we do meditation. And the reason that we do that is it's very difficult to sit if you're fidgety. So one of the reasons why you do a yoga practice first or movement first is so that you're able to sit. So the idea right now is I'd like for you to get comfortable. So if you are sitting in a chair, which most of you are, if you have any books or pillows near you, it's important to have something under your feet, okay? It's difficult if your feet are not touching the floor to be sitting in your chair. If it's the only option you have, it's the only option you have, or put some books or pillows under your feet. Or you can sit in your chair like most people would sit Indian style, or by bringing your feet like this, putting one leg down and one leg on top. So you can do this in your chair. Typically, this may be more comfortable for you, having one leg on top of another leg versus sitting like this. A lot of times when we sit like this, you might be uncomfortable in this area for a long period of time. So if you are sitting Indian style, just do a little butterfly for a minute. It's just let's let those hips just relax for a minute because you're going to be sitting for about 7-8 minutes. So just let go of any holding or tension in your hips. Okay. I can't see everybody, but I can see the panelists. So you all are doing very nicely. And so now you're just going to find a comfortable position. Now, this can be sitting straight up, sitting Indian style, or like I showed, feet on the floor or something underneath, or you can lay down. Now, obviously, I can't lay down or you won't hear me. So what I'd like you to do is be comfortable, but your arms should be comfortable too. So if you are laying on the ground, typically you'd want your arms at 45-degree angle. Sometimes it's nice to have your arms here, or cactus arms laying on the ground that way, if you are laying on the ground, Brooke. So perfect. But you can do that in your chair. I don't know if you'll last 7 minutes like that, but you can try. Okay, so my entertaining time is over for a moment, and we're just going to hopefully be all comfortable. You can have your eyes open, or your eyes could be closed, or your gaze can just soften. And just bringing your awareness to your breath, putting your hands on your belly, or if you don't want to touch your belly, just bringing it above your abdomen. And let's focus on how our belly moves when we breathe. The belly should rise on your in-breath, and your belly should fall on your out-breath. Breathing in and breathing out. Breathing in, breathing out. Belly breathing is one of the best things that we can do to calm our body down and to become aware. The next place I'd like you to focus is bringing your attention to your chest. And just breathing in for a count of 4 through your chest. Breathing out for a count of 4 through your chest. Breathing in and breathing out. This time, I'd like you to turn the corners of your lips up into a smile. Still breathing in for a count of 4 through your chest. Breathing out for a count of 4 in your chest. Take a moment to notice how different your body feels when you smile. Notice your breath. Are you breathing fast? Are you breathing slow? Are you taking a nice full breath? Are you breathing shallow? Just notice your breath. Keeping your smile on your face. Just notice if anywhere in your body you're holding any tension. Bring that smile to that area and tell that area to relax, release, and let go. Your whole body should be radiating with this beautiful smile that started on the outside and is now penetrating all inside. Continue to breathe. You yourself, more than anyone in the universe, deserve your love and your affection. And during this time, we're going to scan our body. You can just bring your mind's attention to the areas that I tell you. If you want to move those areas, you can do that as well. It's a time to appreciate our body, to shift our thoughts and perspective on how magnificent and the wonder of our body. So let's go ahead and start up with our head, bringing our attention to our eyes. Think of a beautiful picture, a beautiful time, maybe the most beautiful sight you've seen. A sunset, an ocean, a beautiful flower. And thank your eyes for taking in the world, for enabling you to have this beautiful image. coming to your ears, thinking of something lovely that you've heard. Maybe it's the ocean, the rain, birds chirping, children laughing, someone telling you that they love you. Think of something that's pleasant to your ears. And thank your ears for having the opportunity to listen and hear such beauty. Coming to your nose. Scent is very powerful. Thinking of something beautiful you love to smell. The rain, salty air, coffee, essential oils or flower, whatever that beautiful scent is. Thank your nose for allowing you to smell beauty. Coming to your mouth, thanking your mouth for the beauty of tasting really nice, nourishing food. Bringing your attention to your tongue. Thanking your tongue for the ability to speak your truth, for the ability to say lovely things to yourself, for having gratitude for the ability to be able to communicate with your tongue and your mouth. And focusing on your mind, for its ability for insight, for its ability to focus, for the ability to bring you to calm. Thanking your mind for all that it does and all that it does in the background that you have no control over. Coming down to our shoulders. Thanking our shoulders for holding the weight, not just of our head and neck, but the weight of everything that we give to it. And appreciate how strong and resilient your shoulders are. Coming to your lungs. Thanking your lungs for breathing fresh air. And maybe you don't have as fresh air right now, but thanking your lungs for air. Because as humans, we need the capacity to breathe. Coming down to your heart. You have a physical heart and a spiritual heart. And thanking your heart for not just beating, which is one of the key things we have to have, along with breathing, but for the ability for love, the ability for self-love, the ability for compassion. You are worthy of all your love, the most worthy of your love. Bringing your focus to your hands, thanking your hands and noticing for writing, noticing for holding, for painting, noticing your fingers for the sense of touch. And how about those arms? Thanking those arms for being able to hug somebody and being able to receive a hug. So feel free, some of you are moving anyway, feel free to give yourself a hug if you want to feel and thank those arms for everything that they do for you, including getting a glass out of the cupboard. Coming down to your belly. Thanking your belly for nourishing your food so that your body can have the resources that it needs to build healthy muscles, tissues, blood cells, organs, skin. And thanking all those vital organs in your body for all the functions that they do that you consciously don't even have to think about. Your body works for you 24 hours a day, healing for you 24 hours a day. The body only knows how to heal. Coming down to your lower body, noticing your legs and thanking your legs. Your legs help you stand up. Your legs take you from place to place. Your legs help you sit in the car, to sit at the dinner table, to sit here right now. Your legs have an amazing capacity to support you. Coming down to our feet. Our feet and our ankles hold everything. It's not till we injure our feet do we realize how much our feet support us. So just taking a minute to thank your feet for holding you up. So just visualizing from your feet to your legs, to your abdomen, up through your arms, from your abdomen all the way up through your chest, all the way up through your low back, middle back, upper back, and shoulders, and your head. Remembering to be grateful for this magnificent body that's made it through treatment, that's made it through your life, that will continue to be here to serve and doesn't ask for anything in return. So with this, I will just give you a moment again to just go through your body with that smile. If you have any tension anywhere, release, relax, let go. And gently rub your palms together, generating some heat. Bringing your palms over your eyes, gently opening your eyes. Notice. Just notice how your body feels right now than 15 minutes ago. This is your body's natural state. Some of you might feel sleepy because we've trained our body that we only feel this way before bed. But this is how our body's normal state is. And the more you visit it, even just with a few breaths, the more your body remembers and asks you to come back. So that's my invitation to you. Whether you're eating, whether you're walking down a hallway, whether you're about to greet your family, take a moment to breathe, because you have to do it anyway. And breathe with that smile from the inside out and shift your perspective. Namaste. Over to you, Becky.
Dr. Singdahl. Thank you, Julie. That was beautiful. And yes,
Thank you.
it did make me a little sleepy, but it feels awesome.
I wasn't sure on time, so I rushed it because I thought we needed like 20 minutes for question and answer, but even a 3-minute practice will do your body wonders. Just You're one breath away from calm, always.
Beautiful.
Well, we are so grateful for you, Julie. That was just truly amazing, and a really good intersection of where, when we had talked, you said the inside beauty has to meet the outside beauty, and I think you've given us a lot of ability to find our inner peace, and so I think that that's great. So well, I'm gonna do it slightly backwards. I'm going to thank a couple of people who have been instrumental in helping us work through all the details of the webinar, of the workshop, and that's Ali Shrestha and Katie Bates, who have been my interns, who have helped put everything together and helped us through many of our challenges day in and day out. And then I'd also like to thank our media sponsor, Kaylee Vogelsang at Cancer Wellness Magazine. They have also done a really amazing job, and it's a wonderful resource which we'll send out in all of the communication to all of you. And with that, I'd like to open it up to questions and see if anybody who is on the call has some questions specifically for our panelists. And we're happy to take the questions now, and we'll send you our information if you want to send it to us later, if you think of something later. But we're happy to open it up now. Anybody?
And it looks like we've answered all that were here so far. So if anybody has any, go ahead and pop them in that chat. Otherwise, maybe we can give some email addresses or some way to contact.
Well, so Becky, I thought that, everyone will receive a follow-up email, and it'd be so nice if, so what we'll do is we'll put all of the information into that follow-up email about how to reach everybody and you can always communicate with us. We're all social media available, if you want to call it that. And if you open up your box and you think, wow, that's just amazing, I need to take a photograph or a video of it, then great. And let us know how you do with the product, and let us know some feedback as you have it. And we'll look forward to seeing you again. We're planning a more regular, this is our first one, but we're planning a more regular workshop to talk about the different things that people have. And we're looking for, so I'm just gonna go person by person. So Brooke has told us a lot about Clean Beauty. She's offering to us special today. If you reach out to her, you can get your own consultation and a personal consultation about specific things that bother you. Becky has provided you beautiful information about the products, and she's available if you need help with the products and anything else that you might need. And Julie's done her introduction to us about her wellness app, and I am really looking forward to giving it to people and getting some feedback about it. And she's also given us some super good tools to get us through the fall and what seems to be one of the most challenging years ever. And we'll all do it together, but I'm so excited that you've all joined us. And I will put ours in the chat box. And any last moments of questions? Anybody?
You're quiet today.
Yeah, but that's okay. They're all super relaxed from Julie, and so that they haven't quite gotten around to their questions. So I think that with that, we will say thank you so much to all of our panelists, and thank you all for joining us, and we will see you hopefully next time.
Yes, thank you.
Thank you, guys. Bye.
Bye.